charge nurse.
These are healthcare professionals who put their training and expertise to use in a managerial role, with some responsibility to other nurses and support staff, and for keeping order and maintaining care levels. It demands strong leaders and communicators who can stay on top of issues and resolve conflicts between staff members and units. It must understand the needs of their employees and co-workers and serve as motivators who can help a group reach a collective goal or level of care.
What does a charge nurse do?
Oh, hi nurses! I am Aubrey Ko, your charge nurse for today. I'll be discussing a brief overview of being a charge nurse to understand better of what are the roles and responsibilities inside the hospital. And this includes help maintain the quality of care in their units, provide the first level of feedback for nurses under their watch who aren't performing up to standards, create work schedules, help oversee admissions and discharges, and lastly, assisting with more typical nursing tasks such as checking on patients and administering medicine. Thank you, and hope you already have a gist of how a charge nurse works inside the hospital as we proceed to the next. See you!
Charge nurse in position.
A charge nurse is responsible for the operation of the nursing unit over a specific time period. A charge nurse must have a strong foundation of clinical knowledge and skills on which to base judgments and make decisions. He or she organizes abilities to direct nursing tasks and operations, as well as interpersonal skills to facilitate communication and the work of others. A charge nurse accepts the responsibility for and is accountable for his or her own nursing practice. A charge nurse seeks out and pursues opportunities for learning and assumes responsibility for his or her own self-development.
Charge nurse in planning.
One of the fundamental responsibilities of a charge nurse includes planning. In this aspect, the charge nurse identifies the procedures, processes, and patient care to be accomplished during the work period, as well as the resources that will be required to safely carry out the work of the unit.
Charge nurse in coordinating.
A charge nurse is also responsible for coordinating with the co-nurses, or as well as to the other members of the healthcare team. In this aspect, the charge nurse distributes the work of the unit in a manner that makes the best use of the available resources. It is in terms of both personnel and materials, and also take into account the knowledge, skills, and abilities of those persons who will be integral to the patient care process. The charge nurse provides ongoing coordination of work and resources as necessary to meet the changing requirements in the work environment.
Charge nurse in evaluation.
Charge nurse evaluation. Charge nurse evaluates individual and collective outcomes of the patient care provides during their shift. Also, charge nurse compares patient care delivery to accepted standards. And next is, charge nurse adjusts assignments of resources as necessary. And lastly, charge nurse reports changing needs and outcomes to the healthcare staff.
Criteria for selection of a charge nurse.
Criteria for selection includes clinical experience, role model attributes such as positive attitude, approachable and calm demeanor, an ability to lead a group and be an effective change agent, organizational skills, effective communication and collaboration skills, an ability to diffuse challenging situations in a professional manner, time management and prioritization skills, an ability to delegate, flexibility, assertiveness, an ability to problem solve, critical thinking skills, an ability to see the big picture, and lastly is the goal-oriented personality.
Guidelines for workload and assignment.
Guidelines for workload and assignment. When the schedule is created, it should indicate which nurses will be in charge so that all nurses know in advance. Whenever possible, nurses should be in charge on consecutive days. A charge nurse should have a modified patient assignment depending on unit needs.
Charge nurse ward responsibilities.
The specific duties and responsibilities of a charge nurse depends on the size and type of unit or ward they oversee. Their typical duties and responsibilities include managing the nursing care of all patients in the department or ward during their shift, delegating the nursing task between the nurses working in the unit, and coordinating with the physicians when they need nursing assistance. Monitoring patients' conditions and responding appropriately if there are changes in the patient's conditions. Supervising the nursing aides in the completion of their allocated task and advising them on improvements they can make. Detecting any issues that could injure or cause difficulty for staff or patients. Informing physicians of changes in patient's condition, progress, or medicinal needs.
Or charge nurse responsibilities.
An operating room charge nurse is responsible for the day-to-day smooth running of the OR activities. They are tasked to coordinate in conjunction with the trauma resuscitation unit, the general hospital units, and the post-anesthesia care unit. Moreover, he or she is accountable to coordinate patient flow from other hospitals into the operating room. Besides managing the personnel under her supervision, some responsibility of the OR charge nurse include staff education, competency testing, scheduling, and other administrative duties such as budgeting. Another role of the OR charge nurse is that he or she must ensure that the patient is ready for the surgery, the surgeon is available to perform the surgery, the operating room is cleaned and prepared with appropriate equipment, and competent operating room staff is assigned for the procedure. Inside the operating room, there is a board that serves as a visual representation of patient, the staff, and the equipment movement. The charge nurse's responsibility to this is to gather the information from all sources and represent this information on a public display board.
Labor and DR charge nurse responsibilities.
Labor and delivery nurses also play a critical role in the delivery and care of babies, and usually assist the doctor during childbirth. As medical professionals, nurses must be capable, educated, and trained to think critically, make sound nursing judgments, and act quickly. Labor and delivery nurses work alongside obstetricians and other doctors in labor and delivery rooms, helping administer antepartum and postpartum care. Labor and delivery nurses are frequently required to provide the following care: monitor and time contractions during labor and delivery, administer epidurals or pain management and other medications, assist the doctor in inducing labor by administering Pitocin or Cytotec, monitor the vital signs of the mother and the heart rate of the baby, monitor for potentially dangerous complications of medications commonly given during labor and delivery, communicate with the doctor to provide timely and accurate information, identify complications and notify the doctor, and prepare for cesarean delivery, including emergency C-sections.
A charge nurse responsibilities.
Overseeing other ER nurses. An ER charge nurse oversees the rest of the department's nurses, keeping a close eye on them to ensure that they are providing adequate care to patients. The charge nurse is responsible for reprimanding and providing improvement instructions to another ER nurse who behaves inappropriately, fails to fulfill her duties, or provides substandard care. Handling patient concerns. Addressing patient concerns is on the charge nurse's to-do list. Other nurses will refer a patient who is upset about a long wait to see a doctor to the charge nurse, who will explain the reasons for the delay, such as more patients than usual or more traumatic cases. Managing department flow. Even a minor lapse in patient care can be fatal, so it's up to the charge nurse to make sure that there's enough staff and resources on hand. If the ER is understaffed, the charge nurse will seek help from other departments or summon emergency nurses from other shifts. The charge nurse's responsibilities also include keeping an eye on the department's medical supplies to ensure that there is always enough medication and other essentials on hand to provide emergency care. Monitoring patient care. In the emergency room, charge nurses supervise patient care by monitoring vital signs and noting any changes in their condition. They also administer medications and schedule specialist consultations for patients.
Tips and tricks for charge nurse.
Regardless of the department that you are assigned in, you are bound to face your fair share of both highs and lows. With this in mind, having working in the hospital facility for many years, we have been very lucky to experience this journey together with my co-nurses. During this time, we have picked up a whole set of handy charge nursing tips and tricks, promised to make your life just that little more easier. Tip number 1. Stay organized. Staying organized is so important for nurses. Charge nurses have even bigger need to stay organized because they aren't just managing their own patients, but they're managing the entire floor. In stressful environments, knowing who has what, which patient is which, and what needs to be done is important. So here, staying organized is key. Get there early if you need to. Make lists and prioritize what's need to be done. Chart in real time to avoid the backlog of charting weighing you down and making you more stressed. Tip number 2. Know where to find information. A major job of a charge nurse is to know the policies inside and out. This is basically the rules of flow of the specific department. This includes policies related to the admission, discharge, and transfer process, as well as medication administration policies, transfusion policies, and more. These policies will be specific to each facility and department, and a nurse will naturally learn these over time with experience on the floor. Tip number 3. Stay calm in crisis. It is so important to stay calm during emergencies, especially a charge nurse. It will be your job to put out fires left and right, as well as make sure the nurses on your unit handle emergency situations appropriately. Families may be yelling at you because they're angry or frustrated, and patients will literally be trying to die on you. Staying calm is easier said than done, but one thing that helps you stay calm is knowing your stuff. If you know what the policies are and what to do in specific emergency situations like codes, then you will be more prepared. This should give you a sense of calm, especially when these emergencies inevitably arise. Tip number 4. Always try to help out. As a charge nurse, you will need to find time to help out your staff nurses wherever they need it. You may need to place IVs, transport patients to or from the radiology, obtain EKGs, triage patients, and give medications that are ordered. Not only does this make you a good team player, but it also helps the whole department run smoothly. Tip number 5. Be a good team player. There are many ways to be a good team player. Be a hard worker and willing to help other nurses. It's also important to not play favorites. Always have your team's back. Understand situations from their point of view and give them the benefit of the doubt. Nurses aren't perfect and do make mistakes, but be sure to support them however you can. Don't immediately throw them under the bus. These traits are important for not only charge nurses, but any leadership position. So that's it. Stay organized, know where to find information, stay calm in crisis, always try to help out, and be a good team player. Things like these are what we think make up an effective charge nurse. Also, the key to success is to keep an open mind and continually adapt your processes to meet the demands of the role. Thanks for listening!